Imagine walking to the market and halfway through your leg cramps so badly you have to stop. You wait and then pain fades. You walk again, it happens again. You think it's tiredness or maybe an aging, but it is not. Your arteries are slowly closing off, and if you do not act on this warning, you could lose a leg. I am Dr. Vijay Thakore, Senior Vascular and Endovascular Surgeon, and today I am going to explain everything about Peripheral Arterial Disease. Peripheral Arterial Disease, PAD, is a condition where the arteries supplying blood to your legs become narrowed or blocked. This happens due to the buildup of fatty deposits called plaque inside the artery walls, which is called atherosclerosis. As block increases, less and less blood supply reaches to your leg muscles and tissues. Globally, over 200 million people live with PAD. In India, our studies suggest that 1 in every 6 adults above the age of 50 may have some degree of PAD. And the scary part, most of them are completely unaware about that. Now, what are the warning signs? The most classical symptom of PAD is called intermittent claudication pain. This means pain or a cramp-like feeling or a heaviness in the legs which appears when you walk certain distance and that disappears when you take rest. This happens because your muscles need more blood when you walk, but the blocked arteries cannot deliver it. Other symptoms are like coldness or numbness in your feet or in your legs, skin that appears pale, blue or shiny on the legs, wounds or ulcers on the toes or on the feet that refuses to heal, hair loss in the legs, and in severe cases, even blackening of the toes or a foot. This is called gangrene. Gangrene means death of a tissue. At that stage, amputation may be the only option left. So, if you or someone in your family has any of these signs, please do not ignore it. What causes PAD? Wait for a minute. I'll give you top 6 reasons you might be at a risk of PAD. Number 1, diabetes. This is by far the most common risk factor in India. High blood sugar damages arterial walls over time. Number 2, smoking. Cigarette smoke directly injures inner lining of the arteries and accelerates plaque formation. Number 3, high blood pressure. Number 4, high cholesterol. Number 5, obesity. And number 6, age. The risk of PAD increases significantly after the age of 50. If you are a diabetic and a smoker, you are at extremely high risk of developing PAD. I have seen patients in their 40s lose a leg because of this combination. Please take this seriously. Now, how do we diagnose PAD? The first and the simplest test is called Ankle-Brachial Index or ABI. We compare blood pressures in ankle and in arm and find a ratio. Normal ratio is 1. If the ratio is low, it tells us the artery is blocked. Comment down on ABI and I will send you the safe and risk ratio to look for in this test. Next test is called color Doppler Ultrasound, which is a painless scan that shows us the blood flow inside the arteries is normal or not. For detailed mapping, before any treatment, we usually perform a CT angiogram or a conventional angiogram wherein we inject contrast into the arteries or vein, take X-ray images of the arteries, and that tells us exactly about the blockage and the status of circulation. These tests are widely available and they can detect disease very early in time before a serious damage occurs. The good news is PAD is treatable. The earlier we catch it, better are the outcomes. Treatment has 3 layers. The first one is a medical management. We use medications to control risk factors like diabetes, high cholesterol, high blood pressures. We use blood thinners and a very tight control of diabetes. We also prescribe a supervised walking program which actually helps open up new blood pathways. Second is endovascular treatment, which is a minimally invasive procedure. We pass a thin tube called a catheter through the artery, inflate a balloon to open the blockage, and at times, if it is not sufficient, we put a stent to keep arteries stay open. The patient is walking on the same day or the next day after the procedure. Third is a bypass surgery. In a complex or a long occlusions, we surgically create a new route for the blood to flow around the blocked artery using either a vein from the patient's own body or a synthetic graft. The choice of treatment depends on the severity and the location of the blockage and patient's overall conditions called morbidities. But here is the most important message of this video. PAD is largely a preventable and a treatable disease. If you control your diabetes, if you quit smoking, if you walk regularly, eat a balanced diet and monitor your blood pressure, you can dramatically reduce the risk of PAD. And if you have symptoms, please do not wait. Earlier you see a vascular surgeon, more options you have and better outcomes you will have, and better your chances of keeping your limb and quality of life alive. I hope this video has been informative and useful to you. If you find this useful, please share it with someone who has diabetes or someone who complains of chronic leg pain. It could save their life, it could save their legs. Do subscribe to this channel for more vascular health education explained simply by a specialist.